Hello, everyone. I'm Sherry with the CGH Health Foundation, and welcome to our Growing Healthier program. This educational series is sponsored by the CGH Health Foundation. All of our CGH Growing Healthier programs are offered here on Facebook Live, and you can find past programs on our YouTube channel, or just go to the CGH website and click on menu and look for YouTube and radio interviews. In our Growing Healthier programs, we try to educate you about important health topics, and it gives us a chance to introduce you to some of our very knowledgeable providers. And today's no exception. October is Breast Cancer Awareness Month, and our program today is called Getting Through Breast Cancer. So anytime you have a cancer diagnosis of any kind, it really messes with your life and can get very complicated. And we are lucky to have some very talented cancer navigators who can help you to get through the process and who you can ask questions, etc. So Dr. Bird is going to be joined by Charisse Jesiolowski, who's a licensed medical social worker. She's our cancer case coordinator, and two of our navigators, Sue Hageman and Laura Leal. Warren, women's health is a very important focus for the CGH Health Foundation and one of our major emphasis. And so the services that we provide with our women's health program are, first of all, that women can get no out-of-pocket cost mammograms and diagnostics, ultrasounds, and also gynecological exams every year. And so that is one of the things that we truly try to help the community with. And we have a fundraiser for that project coming up, and that is our Delicious Designs auction. It's actually a virtual auction, and the auction is live today. So you can go out to the link and look at all of the beautiful baskets that we have collected and make your bid online. And if you would like to view them in person, we are available for viewing at our offices at 2600 North Locust. Next month, our focus is going to be on hospice and palliative care, and Dr. Bird is going to be joined by Dr. Reeder, who is one of our CGH family medicine physicians, and he is also the medical director for Rock River Hospice and Home. So if you want to put that on your calendar for next month, the program will be live on Facebook on Thursday, November 9th at noon. And now that I've shared all of that, it's time for me to turn it back over to Dr. Bird.
Thank you, Sherry. Nice job as always getting everything set up in terms of what's going on. So thanks. Okay. Well, thank you for taking the time to tune in. And without further ado, this October 19th, 2023, let's get Laura, Charisse, and Sue on with me. Good afternoon, ladies.
Hello. Hi.
Thank you for joining me and taking the time to talk about the work that you're doing. Speaking of which, before we go into more detail, could each of you just kind of give just a thumbnail of what your role is here at CGH in terms of navigation? And I'll start with you because you're top of my screen here, Laura, if you'll go first, and then Charisse, and then Sue. How about that?
Okay. All right. Well, hello, everyone. My official title is Diagnostic Imaging Coordinator. So I kind of work within the diagnostic imaging department, and included in that is my role as a navigator. I help women through the process of having their mammograms done and waiting on those results on how everything turns out. So that's just a brief summary of what I do.
Thanks. How about you, Charisse?
I'm the care coordinator for the oncology clinic. I'm a master. Whoa.
You're good.
What? I don't know where I went.
You're still here, Charisse. It's all good.
No, I can't see myself, so okay.
Oh, we can see you though.
Okay, well then good.
Yeah.
I'm a licensed master level medical social worker. I have 25 years experience in hospice, with 8 years of that experience through the VA. My main role, I feel, is to talk with the patients to find out what they need, listen, and help provide resources for the patients and families, along with helping veterans access their VA benefits.
Sure. Good. Okay, well, thanks, Charisse. Charisse, you are kind of like starting to suspended animation on my screen, so I'm going to have you work with Rebecca and Dana to get that all fixed. But I'm going to move on to Sue here. And Sue?
Okay. Hi, I'm Sue Hageman, and I am the oncology nurse navigator for the department. And I'm kind of on the front line with the new patients and take care of all the new referrals. So you'll be seeing me a lot at the beginning of the journey through our department.
Okay, great. Okay, very good. So I'm going to start with Laura. And Laura, I have a few questions I want to run by you here, okay?
All right, you fire away.
So just so everyone is clear, yeah, so Laura is a nurse, actually works in our X-ray department, I guess, for folks who are diagnostic imaging is code for everything that you need an image of. Laura helps out in that department. And a lot of different things that she does, but we're going to focus in here. And what I want to talk about with you, Laura, is just in more detail, talk through with me the process and the support that we have in place here at CGH to help women who has a mammogram and it comes back as abnormal. And how do you fit into that process?
Okay. At that point, they've had their mammogram. The report process is read, or the images are read by our radiologist. Our radiologist puts out a report. That report comes to me with a BI-RAD score, and typically if they're a BI-RAD score of 0, that means there's some further workup that's needed, and that's where I come in. I call our patients. I let them know that, hey, we've had you in for this particular procedure. There's an area of concern there. We'd really like to get you in to get some additional imaging that is recommended and make sure that it's nothing too concerning at that point. And then from there, I work with them and get them into the appropriate modality, whether it be additional mammogram imaging or a breast ultrasound of that sort. I get them scheduled, work with central scheduling, and we just wait to see what happens at that point.
Okay. Yeah, so once they have the mammogram, essentially, they're in your hands to get any further testing done.
Correct.
To look into what's going on. And then let's say they go, that woman goes through the process. And at the end of that process, we're still concerned. We still have like that we're concerned about what either came out of the diagnostic imaging, or maybe even they had our radiologist did a biopsy and found that there was a malignancy. Can you kind of talk through both of those situations, how you help to get the patients on their next step in their journey if they're moving towards having breast cancer?
Okay. They come in for that additional screening that I scheduled them for. And at that point, the imaging is done, and our radiologist pulls me into their office and says, hey, Laura, we got to go talk to this patient. We want to get them set up for the biopsy. There's an area that we think is going to be concerned, and we should really check it out. So what I do at that point is they let me know what type of biopsy procedure is going to be done. We have a type of biopsy called the stereotactic biopsy that is done in our mammogram room. And then we have an ultrasound guided biopsy that is done in our ultrasound room. So I grab all the information. I grab everything that is needed for the patient to prepare for that particular examination. We have patients that do take our blood thinning type of medications. So we want to make sure that everything is covered for their safety and reduce any risk that may occur with those procedures. Now they come in for the biopsy, and we have them wait for that report to come back, right? It takes about 4 or 5 business days to get that initial diagnosis. When that happens, after that biopsy is done, we schedule them for a 1-week follow-up, and that's when we go ahead and meet with them and anyone that they bring, and our radiologist delivers the news. At that point, radiologists will answer any other questions, and that's where I step in a little further. I come in, make sure they understood what was told to them, provide them with some information, and then we're working at that next step of getting set up typically with a surgeon and moving forward there.
Okay. Yeah. And then thank you. So I hope folks are hearing in this that basically from the moment you show up to have a mammogram done here at CGH, Laura is with you.
Yes.
And with you through that whole process, and is at times literally holding your hand through the process, whether things turn out well or not.
Correct.
In terms of a diagnosis. So to me, that gives me comfort that you're there doing that for our patients, Laura.
Thank you.
Yeah, so thank you. I do want to talk about, though, what is your role once the patient then is referred to a surgeon, and eventually if they need to go see our oncology department and see Dr. Ali Khan or Dr. Al Saeed and the rest of that team? What's your role, and what's your role going forward after that, Laura?
I serve as a pillar between the three areas of service. So I am kind of the one-stop shop for our patients to come in. I'm working with their primary care provider if they have a question and they need to get answered that way. I'm working with our radiologist if they need to, have something answered. I'm working with oncology. I'm talking to Sue and letting them know, like, hey, Sue, this patient's headed your way. This is what the diagnosis is. I just, I hand off to Sue and the team there. And, just because at that point I'm handing off, I'm typically not done with them. I always let them know that I'm available to them throughout their entire journey. I'm here to serve them. And that's my ultimate goal. And it keeps me happy that I can serve them. So.
Yeah. Thanks, Laura. So you had mentioned that one of the people that you're definitely going to be reaching out to is Sue, who works in our oncology department.
Yes.
Who's our nurse navigator there. So thanks, Laura. I think what I'm going to do now is transition to Sue. There she is. Hi, Sue.
Hi.
Yeah. So Sue also is a nurse who does navigation in our oncology department. And Sue, I'm just going to give you the floor here to kind of talk about the work that you do to coordinate clinical care for patients receiving cancer care. And let's just maybe talk about breast cancer care for the moment at CGH.
Yeah, sure. So typically, like when Laura has a patient that she knows has a breast cancer diagnosis, she will let me know even before the actual referral. She gets in touch with the surgeon. Most people have to go see the surgeon first, but that's not always the case. Sometimes they need to come straight to oncology, depending on the situation. So once that referral is made, I gather records, scans, any biopsy reports, and I really create a packet of information and get her scheduled with either Dr. Al Sayed or Dr. Ali Khan. And I'm the first person that will call her from our department. So usually I will call that patient, introduce myself, kind of tell her what the plan is. We need to see her for a consultation, and then we schedule an appointment. We can usually get people in literally within a week or less. Everybody's situation is different. We might be waiting on a report. So we make sure that we have all the reports that we need before appointments are scheduled. And then when she actually sees the doctor, I've seen the new patients with the doctor, really the first 2 or 3 visits to, again, like what Laura was saying, making sure they understand what the doctor has said and what the plan is, and educating about the cancer itself. And then each visit builds on the last. So I do step in and do education on, if somebody has to have chemo, then we go over that, and lots of opportunities to ask questions. So,
yeah. And then as they go further, as they move forward with, like, let's say that there's some sort of treatment that they're going to receive, how do you fit in then, Sue?
Okay, so typically for a breast cancer patient, you know, most of them will have some sort of surgery, some sort of systemic treatment, whether it be hormone therapy or chemotherapy. Sometimes they need radiation. Sometimes they need all of those modalities.
Yeah, yeah.
So whatever they need, I'll do education with them. I'll tell them about it. The doctor goes over it. We give handouts. We, just go through the whole process with them. And I coordinate care with the radiation center as well.
Yeah, great. How about with those patients who are receiving care here at CGH and also receiving care somewhere else? I know it's not uncommon for both of our doctors are really comfortable with patients getting a second opinion somewhere.
Sure.
And say, hey, does that make sense? And by the way, almost all the time, the people for the places they go are like, yeah, that sounds perfect.
Right.
But anyhow, they encourage that. So how do you coordinate those kind of things between other institutions and the work and the care that patients are receiving here at CGH, Sue?
So when a referral is needed at an outside facility, and a lot of times that's maybe at a university setting where they have very specific teams that work with a specific type of cancer. Sometimes we need a surgeon that only does a specific procedure. And so we make a referral, we send the records. I'm in contact with a lot of other nurse navigators at other institutions. A lot of times I'll just pick up the phone and call one of them or email them. Our receptionists are amazing because we have all the contact information for wherever we want to send somebody, and they help facilitate those referrals. So like even when we send our patients to our radiation center, I'm in contact with them, coordinating care. So a lot of phone messages, emails, whatever it takes to have the coordination of care. We just don't send the referral and drop it, a lot of follow-up.
Yeah, perfect. Once again, I want folks to be hearing this to hear that once Laura's done her work, she's still staying with you.
Mm-hmm.
And Sue is very much going to be involved and will walk you literally at times by the hand through this process, through a diagnosis of any type of cancer. But in this particular case, we're talking about breast cancer. So thank you, Sue, for all the good work that you do. Okay, so that's Sue and what she's doing. And now I want to bring in Charisse. And so Charisse, you're a licensed clinical social worker. So
I'm a licensed medical social worker.
Oh, that's right.
Licensed master level social worker.
Got it. Sorry.
I'm not clinical.
Okay. What I wanted the main point I was trying to make is that you're different than a nurse. So you have a different skill set.
Yeah.
So I want to talk about that with you. So talk about how you come in contact and what your role and how you connect with patients once they become part of the oncology department and need care there.
Okay. I connect with patients in all different ways. A lot of times when they're back getting chemo, I'll go back and just sit and talk with them. I will kind of do a psychosocial assessment. In a way, I'll find a little bit of history. I'll talk to them about their families, their hobbies, trying to get to know them a little bit to build a trust with me. I mostly listen when they talk. I also get called into the office. Sue will call me in sometimes if there's a need. She needs help from me to address, whether it's hospice, palliative care, needs in the home, which we'll get into in a little bit. Anything that I can do to help with what those patients need. at
Yeah.
that point, outside of the medical issues.
Yeah.
I also connect with them through our oral chemo questionnaire. That's a questionnaire that's through the Quality Oncology Practice Initiative, which we've been recognized in the past for. I call those patients weekly to see how they're doing on a new chemo regimen pill that they get. So I'm keeping contact with them. I'm building a rapport with them so that they can feel good enough to ask me questions and confide in me and that kind of thing.
Yeah. You mentioned needs that they have. What are some of the needs that you find yourself addressing on a pretty frequent basis with patients?
Whew. A lot of housing issues, help in the home. How can we get them extra help? I set up Meals on Wheels, physical therapy, palliative care is another one that I have a heart for. It's to make sure that they have someone checking in on them medically and socially, so that they're not feeling like they're out there alone. I do hospice referrals. Again, I've done hospice for 25 plus years, and I do advanced directives, DNRs. Yeah. I usually ask if they're veterans because I do know how to get around the VA.
You have to get around that? It just doesn't happen, huh?
No, it doesn't. I know how to get their benefits. I know how to help them find their benefits that they deserve and need. So there's a lot of different ways that I connect with them. And I mostly listen to their concerns and try to help find solutions to the needs at the moment.
Sure. And you already mentioned this a little bit, but just speak a little bit about how you interact with our clinical staff, with people like Sue and our doctors and Lindsay, our nurse practitioner in the department, in terms of needs that you identify and how how you make sure that they know what's going on.
There's the people up here are just amazing, and we have a really good rapport. I work side by side with them. If they identify a need, they'll let me know. If I identify a need with medication or somebody brings up side effects or things like that, I talk to them because that's way out of my scope of practice. But they'll bring me into conversations, and we'll have a three-way with Dr. Alcon or Dr. Althad, and just listening to the family and offering how I can help. I am amazed at the nurses and the doctors up here. They are a very special group of people, and we're all here for the same reasons, and that's to help the patients.
Yeah, couldn't agree with you more. And for those who are watching, Charisse is the newest member of our navigation team. And those of you who are out there watching, I want you to understand exactly the same thing about Charisse. She's very caring and very knowledgeable and able to make things happen in terms of needs that are identified. And I keep hearing that feedback over and over again, Charisse. So thank you for the work that you're doing there too.
Wow, thank you.
Yeah. Okay, I'm going to have all three of you on for just a moment here. Okay. We have just a little bit of time, and I wanted to ask just if you all would be willing to share what are the favorite thing or things about your jobs that you do?
Well, I can start. I enjoy teaching and educating the patients about their cancers and their treatments, because I feel like knowledge is power. And when you understand what's going on, at least that gives some comfort that you understand where we're going with all this. And I do love building relationships with the patients and their families, and they become like our family. They honestly do. And I was just going to say something about Charisse. We had a patient recently that she went so above and beyond, you know, helping arrange some housing issues. And without that, I don't know how this would have, you know, all
It would
happened.
have turned out
So
well.
it is a team effort. It really is. I mean, the doctors and Lindsay will do anything that we need for these patients. So it's really a great group to work with.
Yeah. Thanks, Sue.
Yep.
All right, I will go next.
Okay.
Some of the favorite things about my job are just building the relationships with the patients. I didn't think I would become attached to them, and I have, and I love to see them in their highs, but I'm also there to hold their hand in their lows, and that just holds a special place in my heart. And then the staff that I work with here, whether it's over in oncology, over in surgery, or here down in diagnostic imaging, I'm very thankful to work with a great group of people.
Well, I have to agree with both of them. You know, along with the best staff I've ever been honored to work with. I think helping patients and families on this journey, holding their hand, letting them know that there's hope, give the support that they need, and know that we're going to get them through this journey with the support and hope that they need. Even in a bad situation, there's still hope.
Yep.
So that's what I find very rewarding for me.
Yeah. Yeah, this has been a really good conversation with all three of you, and I hope the folks that are listening to this and hear this, whether that's now live or they share that with someone who watches this, gets just what a sense of ownership and care that Laura and Charisse and Sue and all the people that are part of caring for folks who have breast cancer or other cancers here at CGH. They are wonderful folks. They're very good at what they do, and they're very caring about how they do it. So, ladies, thank you so much for being here with me and for answering these questions. And no one wants to be talking with any of you, at least in your professional capacity.
Yeah.
But it's great to know that you're there should that situation arise.
Right.
Exactly.
So, and thank you, Rebecca, for putting up that number about how to connect with our navigators. So, all right. Well, Charisse, Laura, and Sue, thank you so much. And I will let you go.
Thank you.
Thank you.
Okay. Yeah, I enjoyed that. And I wanted to show a few other things just to give you updates on things going on here at CGH. So first of all, we're in the process of doing some construction, quite a bit. Some much needed updates to some areas here at the hospital. So the pink area that you're seeing there are where the patient parking is now. And I'm going to butcher this somewhat, but the main clinic where you go in to see doctors in the clinic and nurses and nurse practitioners and PAs, that hasn't changed. But what has changed is that main entrance parking lot that's black there has flipped to the other side of the main entrance on the southwest lot. That now is patient parking. And then also that whole long area along the east side of the building is patient parking as well. So I just want to make sure that we have put this picture out there for folks, and we're going to have some of this parking for a while now as we go through this construction process. But I think we've made sure we have ample parking for our patients when they come to CGH. And then, yeah, thanks, Rebecca. This is just kind of some, and this is on our website too, if you need to look and see. But one of the entrances that people don't realize we have is on the west side of our campus. There's actually a place you can come in to and access both the inpatient part of the hospital as well as our clinics. So that's an option for folks to get in. Okay, flu shots going on. There's the times that we have them. So I encourage everyone to get their flu shot. And yeah, we have our annual holiday lighting ceremony November 14th. So put that on your calendar. And I think this may be the first year since the pandemic that's going to be live. But anyhow, that's always a good time. Want to congratulate Saul Serrano as our Employee of the Month. Saul is a very positive guy. I see him up there quite a bit in the ICU. He works there and does a great job. So congratulations to Saul. And as Sherry alluded to when we started our program, looking forward to next month talking with Dr. Reeder, who's been involved with hospice and palliative care his whole career. So he'll be a wealth of knowledge for us to talk about all things hospice and palliative care. All right. Well, thank you for taking the time to watch this. And I encourage you, if you found this valuable, to share this with others that you know that might be interested in hearing this information. Thank you for watching, and have a great day. And we'll be back next month. Thank you.